Hey there, welcome back to my channel. If you're new here, I'm Devi Sundar, and in my channel, I talk about breath, mental health, and occupational well-being. Today, I'm going to dive into one of the most important challenges faced by our NHS, the rising cost and admissions linked to respiratory and mental health conditions. With healthcare costs spiraling and hospital admissions for respiratory and mental health issues stretching NHS resources very thin, it's time to ask a deeper question. So, why are these conditions leading to such a surge in hospital visits? And are we taking the right approach? Let's start with respiratory health. Did you know that respiratory disease now account for 1 in every 8 emergency hospital admissions in England? These include conditions like asthma, COPD, which are becoming increasingly common and very serious. In fact, 5.4 million people in the UK are currently receiving treatment for asthma and 1.2 million for COPD, according to the British Lung Foundation data. These aren't just personal health issues, they are public health challenges that drive up the hospital admissions and put a strain on the healthcare resources of our nation. The NHS long-term plan has already identified respiratory disease as the third biggest killer in UK, right after cancer and cardiovascular disease. Respiratory conditions don't just impact the health, they drive up the hospital admission and drain resources due to frequent visits and readmissions. We talk a lot about integrated care. For decades, we emphasized the importance of asking people what matters to them, taking a page from Socratic questioning. But are we focusing on the right questions? What if instead of just asking what matters to them, we become more specific? What if we asked, does breathing well matter to you? Does joy and happiness matter to you? Does learning new things and staying mentally sharp matter to you? These questions go deeper, connecting with the things that bring people a true sense of well-being. Why I focus on the right way to question. Right questions are very important for right and timely actions. There are many issues which needs problem solving with funding, workforce, and policy reformation, not only in the UK but worldwide. The number one issue is the air quality. It is a major factor here. Poor air quality doesn't just harm the environment, it directly impacts our health. According to Public Health England, respiratory problems linked to air pollution cost NHS and social care systems around £157 million a year. And the numbers keep rising. And studies have shown air pollution is responsible for approximately 40,000 premature deaths annually in UK, with respiratory and cardiovascular disease leading the way. Tackling air pollution could significantly reduce the hospital admission for respiratory health. Number two is smoking. Smoking, while on the decline, is still a significant driver for the respiratory health issues. In the UK, smoking is a cause of around 70% of COPD cases, which leads to more frequent hospitalization. With current smoking rates around 13%, each smoker costs NHS an extra £1,500 in healthcare costs each year. Number three, the UK's aging population adds another layer of complexity. Right now, around 12.6 million people in UK are over the age of 65, and this is projected to rise sharply over the next couple of decades. An older population is more prone to respiratory and other chronic conditions, putting an increased pressure on the hospital resources. Take Gloucestershire, for example, where people aged 65 are more in a greater proportion. According to the Gloucestershire County Council's latest population data, 2023, around 150,000 people in Gloucestershire are aged 65 and over, accounting for about 24% of county's population. This is notably higher than the national average. The Gloucestershire population aged 85 and over is about 20,000, with this group projected to increase more than 60% by 2043. High number of older residents in Gloucestershire calls out a greater potential for and demand for respiratory and other age-related healthcare services. With this demographic shift, we can expect a greater demand for respiratory care in these regions, with higher concentration of the older adults. The British Thoracic Society, BTS, emphasizes older adults are more vulnerable to severe consequences from respiratory infections, which frequently result in emergency admissions for illnesses such as influenza, pneumonia, and COVID-19. So what we can do to prevent these costly hospital admissions? Evidence show that preventive programs work. And for instance, a study published in the BMJ Open found pulmonary rehabilitation, that is lung rehabilitation, for COPD patients can reduce hospital admission by 43%. NHS is working to expand the early detection and community-based care and access to treatments to cut down the emergency visits and save millions, but the care is not integrated or holistic to date. Another issue is the current staffing in doctors, nurses, and allied health professionals to the patient ratios are not meeting the WHO recommendation, where the guideline is one doctor for every 1,000 patients and one nurse or allied health professional for every 10,000 patients. And this applies to the psychiatrists as well. One psychiatrist for 10,000 patient ratio is a guideline. As of the recent data in Gloucestershire, the population is approximately 688,000. This region faces a notable shortage of doctors related to the demand, and there are around 578 doctors, including those in training, in the county. Though only about 358 of these are fully qualified GPs, meaning that on average, each GP is responsible for around 1,920 patients. This workload has grown as a population and healthcare needs have increased, surpassing what is often considered an optimal doctor to patient ratio. Mental health is another area that's seeing a surge in admission. According to the recent NHS data, emergency mental health admissions have risen over 15% since 2020. The pandemic, financial pressures, and social isolations have all contributed to this increase. Severe depression, anxiety, psychotic disorders are now some of the most common reasons for emergency admissions. Beyond the human toll, a study by the Center for Mental Health confirms untreated mental health issues accounts for 5% of all the hospital admissions, straining the NHS resources, costing the UK healthcare system about 118 billion pounds each year. People with severe mental health conditions also have a readmission rate, adding to the cycle of strain on the resources. This is where asking the right questions can be transformative. We need to look beyond what matters to you and dive into questions that connect with core human needs. When we ask, does breathing well matter to you or does joy matter to you, we move toward integrated care that's truly meaningful to the person. This approach doesn't just treat the symptoms, it empowers people to focus on their overall well-being. With both respiratory and mental health conditions leading to more hospital admissions, it's clearer we need to take a proactive approach. Strengthening preventive measures like air quality improvement, smoking cessation, and mental health support can improve patients' outcome and reduce the pressure on the NHS resources. That's why Tele-Therapies Limited is launching the Breathe and Connect project, a wellness initiative focused on the respiratory health, mental health, and social connection, especially for the older adults in Gloucestershire. Our programs like Luma Breath sessions held every Saturday are designed to help participants improve their lung function, manage stress, and create community bonds. Interested in joining us? Sign up using the link in the description box below. Take a step towards better respiratory health, mental wellness, and a stronger community. Thanks for watching and staying until the end of this video. Don't forget to subscribe for more how you can support a healthier community. And if you found this video helpful, please do give it a thumbs up and share it with others. Until my next video, stay healthy, stay curious. Signing off, Devi Sundar.